Hello, everyone. We'll get started shortly. We want to give time for everyone coming in from the waiting room, and we'll get started shortly. Awesome. Okay, I still see that there's still more people joining us, but I wanted to say hello and welcome to the Messaging Brain Health and Public Health Strategies for Dementia Risk Reduction webinar. Next slide, please. I would like to introduce myself. I'm Michael Lewis. I am the Associate Director for the Bold Public Health Center of Excellence on Dementia Risk Reduction at the Alzheimer's Association, and we're happy to have you all joining us today. Next slide, please. I did want to highlight that this webinar is hosted by the Bold Public Health Center of Excellence on Dementia Risk Reduction and is funded through a cooperative agreement with CDC. Next slide, please. And as you're coming in from the waiting room and joining us on today's call, we're thrilled to have you here today. So please let us know in the chat where you're listening from. And to kick things off, let's hear from you. So in the chat, share one message you wish your community understood about brain health. It can be a myth you'd like to bust, a fact you think is undershared, or just a message of hope. I'll go ahead and start us off with, for my community, I hope that they understand that your brain thrives on challenges and to learn something new every day. So I look forward to reading all of everyone's thoughts and ideas on what they would like to share in their community as we're going through the webinar. Next slide, please. Before we get started, there are a few housekeeping items I'd like to mention. As a reminder, the recording will be shared with all those who registered for today's call. Any personal recording devices of this webinar is not allowed, and unfortunately, we will have to kick them off. If you would like to use closed captioning, you can do so and enable it using the toolbar at the bottom of your screen. And please feel free to put any questions you have for our speakers today in the Q&A box, and our speakers or someone from the public health team will respond. Next slide, please. Awesome. We'll begin today with the learning objectives, a resource overview, and hear from our presenters. And at the end of the webinar, we'll have a panel discussion and Q&As. Next slide, please. So on today's webinar, we hope you leave with the practical tools and inspiration to strengthen brain health awareness in your community by understanding how to effectively communicate key strategies to increase knowledge and awareness about dementia risk reduction, applying key concepts of the messaging toolkit to understand your community's needs and identify opportunities to promote brain health, as well as hear from our health department leaders as they share their experiences on crafting and implementing awareness campaigns in their states. Next slide, please. To help us accomplish these learning objectives, we do have some great guest speakers. We have Stephanie Smith, who is the Dementia Education and Prevention Program Manager at the State of Alaska Department of Health. We also have Kristen Felton, who's the Dementia Specialist at the Office of Aging at the Wisconsin Department of Health Services. And lastly, but definitely not least, we have Kat Woodall-Colcom, who unfortunately is unable to join us on today's webinar, but I really wanted to share and highlight the great work that she did on the development of this messaging toolkit, as well as the promotion and development of this webinar. So thank you, Kat. Next slide. One of the great things at the Public Health Center of Excellence on Dementia Risk Reduction that we were tasked by CDC to do was review that scientific evidence on dementia risk reduction, take that evidence and translate it into things public health professionals can use, and then assist those public health agencies to put this work into practice. So we partner and collaborate with public health agencies nationwide to implement dementia risk reduction into existing chronic disease programs like diabetes prevention, health and wellness cooking classes, and smoking cessation programs. Next slide, please. And here we wanted to highlight a few community messaging and services opportunities for brain health. So communicating effectively to inform and educate people about health factors is a core public health function and one of the essential public health services. The Healthy Brain Initiative State and Local Roadmap for Public Health 2023-2027 uses this essential public health services framework to detail the important role that state and local health departments play in educating the public health to increase awareness and understanding of diseases and conditions. Additionally, the Healthy Brain Initiative Roadmap for American Indian and Alaskan Native peoples provides culturally relevant guidance and strategies to support brain health and dementia risk reduction in American Indian and Alaskan Native communities. Next slide, please. Here, the center created this messaging toolkit to help public health agencies synthesize evidence, map partners, and launch culturally responsive campaigns to improve brain health. What you'll leave here today with is a step-by-step approach to identify your community's needs, mapping your partners, developing, implementing, and evaluating your messaging campaign. Practical resources in the toolkit includes an appendix, case studies, as well as tools you can use immediately, and then a toolkit that is adaptable depending on if you're a large or small effort and designed to work across diverse communities. Next slide, please. First thing behind the background when it comes to the messaging toolkit is that it stems from a public health research roundtable convened by the center and Wake Forest University School of Medicine to review and discuss the scientific evidence on how to best drive effective public health action. Now, this report you see on this left side of the screen summarizes the proceedings of that roundtable, capturing the key discussions and outcomes that served as a bridge between research, public health practice, and implementation, informing future strategies and interventions geared towards reducing dementia risk. Effective messaging is simple, practical, action-oriented, and delivered by trusted messengers. Gained framed messaging like exercising strengthens your heart and brain generally outperforms lost frame messages like if you don't exercise, you could get heart disease for preventative behaviors. So when you're thinking about these campaigns, you should consider addressing environmental barriers as well, such as lack of spaces or safe spaces and sidewalks, as well as pairing individual prompts with system-level solutions for sustainable impact. And to learn more about the science behind behavior change, please take a second when you have time today or over this weekend to read frameworks and strategies for driving action on dementia risk reduction through behavior change. Next slide, please. Now, step one of the messaging toolkit is identification of needs. And that starts with understanding your community and its perceptions of brain health and understanding cultural, social, and environmental influence. So using tools like the Neighborhood Atlas and Area Deprivation Index on the screen helps to identify those social determinants and areas of greatest need. Assessing local risk factors and health behaviors using population-level data from data tools like the Behavioral Risk Factor Surveillance System, or BRFSS for short, county health rankings, and CDC places helps to highlight local risk factor prevalence at state, county, and census tract levels. And one of the things I like to highlight is that reviewing your state or tribal planning resources alongside additional resources like the Healthy Brain Initiative roadmaps, your state health assessment or county health assessment, your state health improvement plan or your county or community health improvement plan, as well as elder needs assessments can help leverage your agency's surveys or focus groups. Next slide, please. Going into step two and talking about partnership mapping. So after you've decided which health behaviors or risk factors to focus on, the next step is mapping out those partners who also address the risk factors and may be able to assist with the awareness campaign. Because as most of us know, public health efforts succeed through multi-sector collaborations. Partners bring credibility, resources, trusted voices, ensuring that the messages resonate across diverse audiences and age groups. Preferences for communication vary by race, ethnicity, and setting. And that is shown in our 2024 Alzheimer's Association polling data of the United States adults on their brain health knowledge and engagement in brain health activities. And one of the things from the polling data that we saw was some of the groups preferred social media. However, others relied on the radio, community events, as well as their faith leaders to hear about brain health messaging. And as you're building or planning your brain health campaign, remember to ask yourself, where does your audience go for their health information and who do they trust? Next slide, please. So now going into step 3, as you're developing a messaging campaign, sometimes it can contain subsections, including planning and effective campaign considerations, specifically for those diverse audiences, and tailoring that communication to be culturally responsive. You want to make sure that you avoid a one-size-fits-all messaging and that it should reflect your community's values, preferences, as well as lived experiences, and really meet people where they are. The use of focus groups and polling insights to tailor your communication channels could also be helpful, as well as content for different populations. So making sure you're not using that same messaging across multiple ethnicities. And then synchronizing and applying that cardiovascular disease prevention strategies to dementia risk reduction can be effective by focusing on lifestyle factors, community programs, and policy initiatives. Next slide, please. And messaging must be culturally responsive, as I previously stated, but specifically in communities at higher risk. So Alzheimer's and other dementias disproportionately affect Black, African American, and Hispanic populations due to complex social and health factors. Successful campaigns use community-specific approaches like faith-based outreach for Black and African American communities, integrating traditional knowledge for American Indian and Alaska Native populations, family-centered resources for Asian Americans and Pacific Islanders, and then culturally adapted Spanish materials and trusted providers for the Latino and Hispanic audience. So using the messaging toolkit's action chart to connect local data, audience insights, and anchor messages to local priorities like walkability, green spaces, as well as intergenerational activities could be a great way to incorporate that all-encompassing approach. Next slide, please. Going into step 4, as we're talking about implementation and evaluation and understanding your community needs, key partners, as well as considering how to reach a diverse audience, we really want to make sure that for the implementation component can be successful with a standalone campaign or by integrating brain health messaging into existing campaigns. Aligning these efforts with initiatives like chronic disease prevention, public health equity, or health improvement plans helps reinforce community health outcomes. Before launching your campaign, plan evaluation early. That means defining your clear goals, whether that's increasing public health knowledge, embedding brain health into your chronic disease programs, but also identifying your priority audience and validating everyone's creativity, as well as using those shared databases with your partners for ongoing improvement and map efforts like the Healthy Brain Initiative Roadmap e-domain, which focuses on engage and educating the public. You can also choose metrics that align with your community's objectives and support ongoing process, as well as highlighting your tracking before the launch of the campaign. And one of the great things about this messaging toolkit is that we provide those common campaign terms and evaluation metrics included. So that way you don't have to go searching. We've already done the research for you, and it's right there in one spot. Next slide, please. And looking at that example messaging, this messaging toolkit is your roadmap for creating effective, tailored brain health campaigns, and it's supported by evidence, examples, and actionable tools. It provides foundational insights into how diverse communities' perceptions on brain health and their ability to reduce dementia risk, helping practitioners design culturally responsive campaigns that resonate with the local needs. And then with that, I will pause here because I'm really excited for us to hear from our 2 public health speakers and hearing how they share their experiences along with crafting and implementing their awareness campaigns. So, with that, I will pass it over to Stephanie.
All right. Hi, everyone. I am Stephanie Smith. My parents are Connie Smith and the late Gary Smith from Wasilla, Alaska. My grandparents are the late Pauline and Marvin Parshall and Yeaman and Ruth Smith from California. I live and work in traditional Denina lands in Anchorage, Alaska. That is a traditional introduction, a traditional Alaska Native introduction that I wanted to start with. Because that's going to be, that's the main topic of what I'll be talking about. So we can go to the next slide. When I started a little over 2.5 years ago, our program was brand new, and we realized we don't know what Alaskans know about dementia. And so that was our first step, is how do we figure that out? We decided that we would start with some focus groups. Alaskans love this graphic on the top. Most Americans don't realize how big Alaska actually is. And so here's an example. And so we decided to do some focus groups. We did one in Anchorage, one in Fairbanks, which is our second largest city after Anchorage, one in Bethel, which is the region where Typhoon Halong hit a couple of months ago back in October, and then Nome. For those of you who follow dog mushing, that's where the Iditarod ends. So those are the four places where we decided to start with our focus groups. And we just wanted to find out, to start with, what do people know? And so the first question we asked, do you think dementia is a normal part of aging? And on the bottom left, you can see that most people thought it's probably not a normal part. Of course, we would want to see everybody in that strongly disagree category, that no, it's not a normal part of aging. We don't believe that at all. So we really wanted to improve that, where everyone understands that dementia is not a normal part of aging. And then with these focus groups, we went through the modifiable risk factors and wanted to find out, just straightforward messaging, this reduces your risk of dementia. Was that believable? And then was that something that you could work on? And so we presented that information. We went through all the different risk factors, and these were the results of what we thought, or what our focus groups thought were most believable, and also what they felt like they could personally work on. So when we had that information, okay, now what would be the next steps? So I wanted to talk a little bit about some of the challenges that may be specific to Alaska. Alaska has 229 federally recognized Alaska Native tribes, and just shy of half of all of the tribes in the country, and a lot of very remote villages and people living off grid, and about 8% of Alaskans don't have any kind of internet at all, and about a third of Alaskans' internet is really low broadband. So yeah, you can probably email, maybe get on a website, but no streaming, no Zoom meetings, anything like that. So that's about a third of the state. And so, you know, we really, as we were going through these focus groups and developing our plan, taking that into mind, just how are we going to reach people, who do we want to reach? Who's our priority? We know that data in Alaska for Alaska Natives is pretty much all aggregated with nationwide data for American Indians. And so there's not strong data yet in Alaska as far as prevalence and incident rates in Alaska. So we decided that would be our priority population that we would focus on for this campaign. So we took this information back, and if you want to go to the next slide, we came up with 6 different storyboards and 6 different scripts of things that we used based off of what people said they believed and what they felt like they could work on. We also looked at campaigns and programs that we already have in-house that we could potentially piggyback on other campaigns already underway, or other plans for campaigns. And so we went back then for another round of focus groups in the same communities. And there was a clear favorite. Healthy Lifestyles storyboard and script was clearly the most well received. And so we went through and, with each storyboard, we asked people the questions: what was good about this? What didn't you like? What could be changed? All those things you normally ask in a focus group. And so here are some of the examples for this one, and why it rated so highly is, who do you think this is for? And most people said this is for people like me. And then is the message believable? And for the most part, the message was very believable. Some of the comments we got were things like, this one does the best job connecting to cultural roots, incorporates the entire lifestyle, includes the food and subsistence way of eating around here. So we heard a lot about that, about, this is right for how things are around here. And so we're like, okay, we're on the right track with that. We also looked at and heard, asked and heard, what are the things that are most important? What's most important to this community? What's most important to you personally? And so we got some really good information from that as well, and found that was actually a really important question: is what is most important to you, as far as this topic goes, or that sort of thing. And we learned that protecting our stories was the most important thing. Protecting Alaska lifestyle, traditional values, protecting the history of Alaska. That was the most important, which was surprising. We thought it would be, oh, I don't want to be a burden, or, or another reason that we hear a lot in more urban settings. But we found that protecting our stories was the most important for our focus groups across the board, even in Anchorage, our largest urban center. And so we took this information back and we produced a 30-second PSA. We hired a well-respected Alaska Native storyteller as our narrator. We used some of our partners across the state, and our production company, our contractor, is an Alaska Native owned, woman-owned company. So we were very fortunate to be able to utilize them. And then we also sought the approval of our Alaska Native Tribal Health Consortium, which represents health programs across the state for the tribes. And so we ended up with this video that has been very well received. It's been out for about a year now, and has it's available on YouTube. We also took the script, and for a lot of the state, radio is still the most important means of communication. And so we also produced some radio spots for it in English and translated into Yupik and Inupiaq. And so for those areas that don't have internet or don't have stable connections, that we're still able to get those messages across. We also did a lot of stills so that we could do some still images, both on local TV networks and also in social media. So a lot, we're able to do screen grabs and that sort of thing with a lot of those ads. So if we want to go to the next slide, we can run the video. Oh, no sound. Can you guys hear that? I can't hear anything.
We cannot, but we'll be sure to drop the link not only in the chat, but also in the recap email as well.
Okay. Um, so yeah, so we finished it off. We did that with some partners in two different areas. Went out to took our production companies out to a couple of places and we're able to get some local talent to be a part of those videos and we're able to share that. And so that was the final product. It's been received pretty well, really well, and we're proud of that work and are continuing along those track for the next year as well. So thank you.
Thank you, Stephanie, and apologies for not having the audio for that video, but it's a great video and I highly recommend that everyone checks it out. If you have any questions for Stephanie, please be sure to use the Q&A box. Again, we will be sure to share not only the YouTube link for that video, but also make sure that we share that with you all. And with that, I want to pass the mic over to Kristen.
Thank you. Hi, I'm Kristen Felton, dementia specialist for State of Wisconsin Department of Health Services, and I am here to describe and share one of the exciting projects that we've been working on as a part of our BOLD grant. Next slide, please. And I will say that I've been with Wisconsin Department of Health Services for almost 20 years, 15 of them as the dementia specialist. And there are always new places to go and things to learn in the dementia universe. This, I'm sad to say, is the first time we have worked with our Office for the Deaf and Hard of Hearing around this topic. And the response has been amazing. People who are born deaf are very underserved related to information and access to diagnosis from medical providers and long-term care from facilities and other providers due to the fact that they speak American Sign Language. They speak ASL. They do not speak English for the most part. English is a second language for people who are born deaf. They learn ASL first, so it's important not to assume that someone who is deaf can read English or can read English well. So having information in a format that is accessible to be able to provide that information in American Sign Language is really critical, and to create and improve diagnostic tools and medical support, as well as long-term care. A story I'll never forget was the CODA, the child of a deaf adult, who's a hearing individual whose mother was deaf. And it was very painful for him to have to move his mom into a long-term care facility because she couldn't talk to anybody else there because nobody else spoke ASL. So there is a huge hunger for information and a big need within the deaf community, as well as you can see in the hopefully well-known graphic on the right, that middle blue circle has hearing loss as an 8% of increased risk if gone untreated in midlife. And a large number of people do age into hearing loss of one type or another, which makes it very difficult to take in information that is verbal. And oftentimes, needing things to be in written formats may also be limiting as far as ease of accessibility for that population. So the deaf and hard of hearing population are very hungry for information. Next slide, please. And in working with our incredible Office for the Deaf and Hard of Hearing, short videos were identified as truly the best medium for conveying information. That, as I'd mentioned, there are language differences between English and American Sign Language. The importance and use of visuals is a very different thing for the deaf community than it is for the speaking community. What's important and how visuals are presented, and the need to include visuals as a large part of conveying information is important to keep in mind. And one of the things that we learned, because as you can see, we have a community-driven format development. So we took this to the community in several different places in the state to the deaf community, to deaf providers, and ask them, how is this for you? Do you like it? Is it helpful? Do you understand it? Is there anything that, is could be better? And right away, we heard no background music, especially for people who are hard of hearing. Any kind of background noise at all is very distracting and makes it very difficult for them to concentrate. So, being able to hear from the intended audience after our first video on how to improve it, we made several changes. One of which, as you'll see in the video, on one side are the visuals, and the other side is the person speaking as Sal. We had to flip them because to the audience, it made more sense for them to be on the other side. Something that unless you are a part of that audience, you wouldn't know. So very important to bring them to the audience and get their feedback as you're developing something new for a population. Next slide, I believe, is our video. So I will turn it over and we can watch as much of that video one as we can. Thank you.
What is dementia? Dementia is an umbrella term to describe a set of symptoms that can include memory loss, confusion, disorientation, changes in mood, and difficulty communicating. The ability to prepare meals, manage medications, handle money, and even perform daily tasks like bathing will also be affected. Dementia is not a normal part of aging. Unlike mental illness, dementia is caused by different diseases that kill brain cells as they progress over time, spreading across the brain and affecting a person's abilities. Each person will experience dementia and their symptoms differently. Dementia is an umbrella term used to describe a range of symptoms associated with cognitive impairment. Alzheimer's represents 50 to 75% of this population. Vascular, 20 to 30%. Lewy body, 10 to 25%. And frontotemporal, 10 to 15% of the population. There are many diseases and conditions that cause dementia. Alzheimer's disease is the most common. It affects between 50 to 75% of people who get dementia. The initial symptom of Alzheimer's.
All right, thank you. So we, as you saw, have our first 3 videos created on those 3 topics. Those are generally, if you're going to a new population that doesn't have a lot of access to information, what is dementia and how do I help are the first 2 questions people want information about. And then we have the next one on brain health. And again, we are still collecting feedback from the community to determine what the final 2 videos we're going to complete under this Gold grant will be as topics. And our process has been really all internal. It was written, filmed, the animations, the creation of the video, the wonderful superstar Jennifer Anderson, who is from our own Office for the Deaf and Hard of Hearing. So this was all done in-house, and it's something that other states are able to replicate. Reach out to your Office for the Deaf and Hard of Hearing. I'm sure you have an entity that does that in your state. So if you have any questions or need anything further, I'll be here for the rest of the webinar, but that is my email as well. Thank you.
Awesome. Thank you so much, Kristen. And one thing, since we have a little bit more wiggle room on time, I would like to invite our speakers to come up for a panel discussion. And then I'll also invite my colleague John to help us with facilitating questions. So again, if you have any questions for one of our speakers, please be sure to use the Q&A box. We will utilize the Q&A box questions to be able to have a discussion.
Thank you, Mikkel. And Kristen, good to see you. And Stephanie, I think you'll be up right there. Excellent. We have our whole panel here. So hi, everyone. I'm John Sheehan, working at the Alzheimer's Association with my public health colleagues. I'm going to take this opportunity just to thank our speakers today, Kristen and Stephanie especially, for sharing this great, they didn't even know they were doing it, but kind of this great public, this implementation of the toolkit that wasn't actually around when you were both working through your different projects. And so I actually want to start there with our panel discussion. We are the toolkit is now available for the public on alz.org/public health. And as you were listening for Stephanie and Kristen here, as you're listening to Mikkel kind of walk through those different steps, I wonder if there was any step or any part of it that particularly resonated with the process that you each undertook. So Stephanie, start with you.
Sure. Yeah. We pretty much followed the steps that are outlined in the toolkit. Step one, we had to find out what our population already knew. Then step two, we looked at what our other public health programs had going on. Where could we partner? What could we build on there? Number three, we looked at, okay, now we have this script, so how many different ways can we use it? So radio spots, in addition to the YouTube, the radio, the Facebook and Instagram, how other ways can we do it to get the message out as much as possible? And then step four, using partnerships that we have, using people in the Alaska Native communities that we have partnered with before, or that knew somebody who knew somebody that we could partner with, and being very mindful that messaging needs to come from the community members. A middle-aged white woman in Anchorage is not the messenger, right? And so being always mindful of where is the messaging coming from. And then we have a follow-up survey that we do every year statewide. And so utilizing that follow-up survey to see, just is the needle moving, where are year by year, where are the beliefs and attitudes, and hopefully behavioral changes coming on a statewide level.
It's excellent to hear. We're going to come back to that kind of that evaluation. How do you tell if this was a success? We're going to come back to that question in just a little bit, but thank you for sharing. Kristen, your thoughts?
So we didn't really go through a nice linear 1, 2, 3, 4, 5 set of steps necessarily, but kind of did things simultaneously in that we were very fortunate to be able to have our Office for the Deaf and Hard of Hearing be in the lead. So the people who are a part of that community, who are also respected in that community as good sources of information. That office holds conferences and large events. In fact, when we first started working with them, had a conference that attracted over 125 deaf individuals in the southeastern part of the state, specifically around the topic of dementia.
Wow.
So there really is a huge demand, and that kind of makes it easy to let the people who are living it lead it, and get the feedback from the community as they go. It's energizing to be able to see people really grab hold of an idea and run with it on their own, which is a lot of what happened with ODHH, and they've been doing other things besides these videos in addition. So there's a lot of energy around it.
That's excellent. That is the mantra that is going through my head, that I more than a mantra, the integral approach that's going through my head, that is probably resonating with quite a few other folks, is the from the disability community, the nothing about us without us approach. And this is very much very reminiscent, making sure that those communities are a part of the messaging, are a part of their own health and their own communication. So just two wonderful examples for these public health messages. So I actually want to bump us down to kind of looking at the clock here to coming back to that evaluation component, measuring the success of these messaging campaigns in terms of awareness, in terms of behavior change. So Stephanie, you mentioned that follow-up survey, but what are the aspects that you're looking for to actually measure how those MRFs are moving or potentially not moving?
Sure. Yeah. And I will preface that with saying, ideally we can go back to those communities and do focus groups again, right? And measure where beliefs or behaviors have changed. Funding and other reasons, of course, that's not always a possibility for us. It's not this year. So that's, a hopeful goal for the future. As far as what we do to follow up is we have a statewide survey that is for several of our chronic disease programs, but a large portion of it focuses on dementia because, of course, that relates to most of our other chronic diseases. And so it asks basically those same questions about the risk factors. Do you believe it? Do you believe this is related to dementia? And then also, which of these are you doing, or do you think it's reasonable that you might be doing? And the reason for that is to help us learn where to put our efforts. If it's, yeah, I believe that, but there's no way I'm going to work on that, okay, we're going to approach that differently than, oh, I didn't know that at all. I need more information. And so we've done that survey 2 years in a row. We did the first one before this campaign went out, and then we did another one in May, so early on in the campaign. And then we'll follow up again next May and get some more information there and just seeing how that work is progressing.
Excellent. So it's not just the change in understanding or knowledge, but the what is that ability for behavior change that you're looking for?
Absolutely.
Excellent. Wonderful. Kristen, anything that your program and your department is looking at for measuring that success, measuring the reach or the effectiveness?
So we absolutely are doing the evaluation as part of our bold project evaluations. But in addition to that, as you heard, we did a lot of outreach to the community, focus groups, and taking it to meetings where deaf adults are already gathered and showing it for, their feedback. It's aside from, the official sort of evaluation questions, we don't have, I wish we had, because that's the magic question, behavioral change, right? What
Mhm.
real impact
Yeah.
has learning these things made? And I wish we could get at that, but we don't. But we certainly can count how many people go to the YouTube channel and watch the video and in addition to all the focus group and other feedback that we've received.
Yeah, absolutely. And that reach component is honestly the first step of behavior change because if they haven't heard the message, if it hasn't been where your communities are at, that behavior change is maybe not going to happen. So I always consider that when thinking about our own work here at the association of reach is a necessary first step. So we always want to get to that larger impact, of course, but we're starting where we are. So. Mikhail, I wanted to ask and pitch a question over to you about local engagement and kind of thinking through what partnerships with health departments, different public health organizations can play out at the local level in amplifying these different brain health messages.
That's such a great question, John, and thank you. I would say at the local level, health departments can collaborate with their local United Ways, area agencies on aging, YMCA partners, depending on the, I don't want to say target, but the community of focus, let's say that the community that you're looking for, being able to have those partners input and identify potential community members who would provide feedback. Again, like Kristen stated, going to the meetings where those communities or group of people are together and gathered and taking your thoughts and ideas and getting feedback at the beginning rather than after everything is developed is highly recommended. And that's something that's outlined in the messaging toolkit. And as a supplemental resource, we do have that behavior change report as well, that just focuses on behavior changing and emphasizing the lengths of what it would take for a person to change their behaviors.
Yeah. Excellent. Um, that local engagement, having those actual connections of the communities. We already heard two excellent examples of this, but just re-emphasizing that it is such to steal Stephanie's paraphrasing, I'm a white guy from Chicago talking to my screen right now, and that resonates with a certain population, but certainly not everyone and definitely not a majority. So working with those local organizations who are from their communities, know their communities, to engage them on these messages, making sure they're accurate, but that they are resonant is always a critical part of everything we're talking about today. I want to encourage everyone to, if you have questions for any of our speakers or about anything you've heard today, please do continue to put those in the Q&A. I'm going to kind of use my moderator's hat and ask us a few more questions before we take some more Q&A from the audience here. One of the things I'm always very excited about, and New Year's is right upon us. So looking ahead and looking to the future, are there innovations? Are there trends that any of you see? I'd like to hear from each of you. Any innovations or trends you see that are going to help us shape these different risk reduction brain health messages. So, Mikhail, I'm going to start with you, and then we'll go Stephanie and Kristen.
Current trend that we are seeing is a lot of health departments are actually having their community health improvement or assessments happening in the new year. So that's a great way to make sure that you're encompassing that brain health or dementia questions in that assessment, as well as making sure that you could potentially build on a messaging toolkit for your local area. So I would say that would be a great resource.
Yeah, excellent. Using those structures that are coming up, that are in place. Wonderful. Stephanie.
I would just say it's an exciting time to be working in this field. There is an eagerness we're seeing to learn more, to get more messaging, to bring messaging and bring education to different programs and different populations, more and more. And even just in the past 2+ years, in that amount of time, I've seen so much growth in there, and feel like that's continuing, and getting providers interested and wanting to learn more about how do I talk to my patients. And all of these topics are just growing and growing and growing. So it's gives a lot of hope and a lot of excitement to me that where in the past people maybe recoiled or ran away from information about dementia, now people are leaning in and are wanting that information more and more.
It's so encouraging to hear that momentum is I feel it building, but I'm glad to hear you're feeling it as well. That's great to see. Kristen, innovations, trends, things that you're looking forward to coming up soon.
I guess I'm just going to piggyback on the excitement that it seems like, because I have been doing this for a while and I'm starting to see some real changes, even amongst certain groups, like the position of the Wisconsin Hospital Associations is very different now than it was 10 years ago. So, even major players are starting to look at things like caregiving, and brain health as prevention, which I never really, after you've been doing this for a while, it feels like nothing's going to change. But it is. It really, things are, even in this environment, things are happening. Things are, I think, improving slowly, but all of the racket we've all been making for so long, I think, is starting to really get through to some. So I'm
That
hopeful.
is, I completely echo that sentiment, Kristen. You and I have been in the space for quite a while now together, And I'm sure a lot of us can relate where sometimes things feel that you're hitting a brick wall after brick wall, or the progress isn't never as fast as any of us would like. But we are at a turning point, it feels like, kind of collectively across the country, certainly within public health, but within a lot of different facets of dementia and dementia care. And so it's honestly because of work like Stephanie in her department are doing, Kristen in her department are doing, and many of you on the call that are actually out there working in community, making sure that these messages, this evidence, the science, and that the kind of the good public health work that needs to happen is in fact happening out there. So, uh, season of gratitude. Just wanted to express my thanks for everyone on that front. All right. So I think we'll take a question or two from the audience, but thank you so much, Stephanie. Thank you so much, Kristen. We may pull you back up for a question or two, but thank you so much. And I think the last thing that we always have a question on slides, whether or not we'll have those sent out. So a link to the recording will be available. And Mikhail, sorry if I'm jumping on your closing here, but the link for the recording will be available in the follow-up email, as well as you saw in the chat, the links for all the resources that you saw today. So with that, Mikhail, I'll turn it back to you.
Awesome. Thank you, John. And thank you for that nice little plug. Yes, the slides will be, the recording of the slides will be shared, as well as those links to the additional resources that Stephanie and Christian shared. But briefly, I just wanted to highlight that potentially if you do not have funding to maybe build on your own messaging campaign, there are resources available that are free and on our website. So the 10 Healthy Habits is a great way to just promote those simple, actionable steps to stay active, eat healthy, and manage chronic health conditions, as well as integrating that brain health messaging. Rather than creating a whole separate campaign, just weaving in brain health into your existing messaging. We wanted to highlight our risk reduction curriculum, as the Alzheimer's Association does offer an interactive online module, and we do offer that community health education specialist continuing education credit. And this is a great way for public health professionals to develop learning practical strategies around dementia risk reduction. And then, of course, a project that's near and dear to my heart is the Community Convenings Program, where you bring together those local leaders to help build on the momentum in your community and share ownership of brain health initiatives in your area. And then lastly, addressing those social determinants of health. We also have a social determinants of health toolkit on our alz.org/risk reduction page. So please check that out. Next slide, please, Juan. And one of our new resources that just launched this past summer is the Brain Health Habit Builder. It's a free online tool to check your current habits and make a plan to help protect your brain. So we used a research-backed guidance to help make this lasting change and to take charge of your brain health. So it takes just a few minutes. You answer a few brief questions, learn a few basic brain health information along the way, and you actually get a personalized plan based on your answers that you can print, save, send to your email, or send to someone who you believe may benefit from this resource. So make sure you give that a check out. Next slide, please, Juan. And to stay connected and hear about upcoming opportunities, this is our lovely silent plug to please subscribe to our monthly public health e-newsletter. There will be some exciting new things launched in the future, especially this upcoming 2026 year. Also, our 27 helpline, we also have that available, and that's available in over 200 plus languages. And then we hope that you enjoyed today's webinar. And if you have any additional questions, please drop them in the chat, and we'll be sure to try to follow up if we can. But if not, have a wonderful rest of your day, and please take care.